These aren't just the window to the soul, they also offer a glimpse into your health. Changes in your eyes can signal vision problems, diabetes, stress, even retinal detachment. What's more, most of these you can actually see for yourself, assuming that you know what you're looking for. Vitamin A deficiency is one of the most common causes of blindness in the world. This vitamin is essential for maintaining your eye's light-sensing cells, which are also known as photoreceptors. If you don't consume enough vitamin A, you may experience night blindness, dry eyes, or even more serious conditions depending on the severity of your deficiency. Vitamin A is only found in animal-derived foods. The richest dietary sources include liver, egg yolk, and dairy products. However, you can also get vitamin A from antioxidant plant compounds called provitamin A carotenoids, which are found in high amounts in some fruits and vegetables. Lutein and zeaxanthin are yellow carotenoid antioxidants known as macular pigments. They're concentrated in the macula, the central part of your retina, which is a layer of light-sensitive cells on the back wall of your eyeball. Lutein and zeaxanthin function as a natural sunblock. They're thought to play a central role in protecting your eyes against harmful blue light. Controlled studies show that intake of lutein and zeaxanthin is proportional to their level in your retina. One observational study in middle-aged and older adults noted that consuming 6 milligrams of lutein and/or zeaxanthin per day significantly reduced the risk of age-related macular disease. The researchers also discovered that those with the highest intake of lutein and zeaxanthin had a 43% lower risk of macular degeneration compared to those with the lowest intake. The long-chain omega-3 fatty acids, EPA, and DHA are important for eye health. DHA is found in high amounts in your retina, where it may help to maintain eye function. It's also important for brain and eye development during infancy. Thus, a DHA deficiency can impair vision, especially in children. Many adults supplement with 3 to 9 grams of omega-3 EPA DHA fish oil per day. Your eyes require higher amounts of antioxidants, more so than many other organs. The concentration of vitamin C is higher in the aqueous humor of the eye than it is in any other body fluid. The aqueous humor is the liquid that fills the outermost part of your eye. The level of vitamin C in the aqueous humor is directly proportional to its dietary intake. In other words, you can increase its concentration by taking supplements or eating foods rich in vitamin C. Several recent clinical trials highlighted the potential role of astaxanthin in promoting eye health, as was suggested by the significant improvement in the outcome of various ocular diseases, including diabetic retinopathy, age-related macular degeneration, glaucoma, and cataract. Typical doses are 12 milligrams per day. In order to achieve this amount through dietary sources, you'd need to consume 1 whole wild salmon per day. Eyebright is a herb with a long history of medicinal use, particularly for eye ailments. It's available as a tea, a dietary supplement, and eye drops, though preliminary evidence suggests that eyebright may benefit inflamed, irritated eyes. Vitamin E is a group of fat-soluble antioxidants that protect fatty acids from harmful oxidation. Since your retina has a high concentration of fatty acids, adequate vitamin E intake is important for optimal eye health. Severe vitamin E deficiency can lead to retinal degeneration and blindness. You want to take a mixed tocopherol form of vitamin E for best results. An increased intake of collagen has been shown to have significant benefits in combating eye-related issues like glaucoma, cataracts, and other related problems, which are more common in individuals over the age of 50. Doses of collagen range from 5 to 30 grams per day. Interestingly, collagen also has been found to have numerous benefits for women going through the menopause, which also seems to kick in around the age of 50 when natural collagen deficiencies seem to take place. N-acetylcarnosine eye drops. Because cataracts and most other age-related eye disorders are caused by low antioxidant and high free radical activity, the regular and consistent use of low-dose N-acetylcarnosine has been shown to be an excellent non-invasive option for the treatment of many eye conditions and even the reversal of cataracts. They can also help to refresh eyes after long periods of concentration, such as excessive computer use, so they may be a powerful protective agent that you can use. Your eyes contain high levels of zinc. Zinc is a part of many essential enzymes, including superoxide dismutase, which functions as an antioxidant. It also appears to be involved in the formation of visual pigments in your retina. For this reason, zinc deficiency may lead to night blindness. Dry eyes is a condition marked by insufficient tear fluid, which causes your eyes to dry up and lead to discomfort and potential visual problems. Evidence shows that taking omega-3 supplements can benefit those with dry eyes. One study in people with dry eyes revealed that taking EPA and DHA supplements daily for 3 months significantly reduced the dry eye symptoms by increasing the formation of tear fluid. Hyaluronic acid is excellent at retaining moisture. It's often used to treat dry eyes. Eye drops containing a 0.2 to 0.4% hyaluronic acid solution have been shown to reduce dry eye symptoms and improve eye health. You can also get hyaluronic acid, which can be taken internally, which will help not only increase the fluid in your eyes, but also in your joints and your skin. GLA, gamma-linoleic acid, from borage oil, also known as starflower oil, and also found in evening primrose oil. Gamma-linoleic acid is an omega-6 fatty acid, and it's found in small amounts in the modern diet. Unlike many other omega-6 fatty acids, gamma-linoleic acid appears to have anti-inflammatory properties. The richest source of the gamma-linoleic acid is the evening primrose oil, and even more found in the starflower oil. Some evidence suggests that taking evening primrose oil can reduce the symptoms of dry eye disease. One randomized controlled study gave women with dry eyes a daily dose of evening primrose oil with 300 milligrams of GLA. The study noted that their symptoms improved over a 6-month period. 2 clinical studies suggest the beneficial effects of SEABUCKTHORN oil on dry eyes. In a study of 100 healthy participants, SEABUCKTHORN oil had positive effects on tear film osmolarity and other symptoms of dry eye. Age-related macular degeneration is an eye disease that may get worse over time. It's the leading cause of severe permanent vision loss in people over the age of 60. It happens when the small central portion of your retina, called the macula, wears down. Research indicates that it may be affected by a combination of heredity and environmental factors, including smoking, obesity, and diet. Results showed that high doses of antioxidants, such as 500 milligrams of vitamin C, 400 international units of vitamin E, and 25,000 international units of beta-carotene, along with 8 milligrams of zinc, reduced the risk of vision loss from advanced age-related macular degeneration in some. In one study, older adults with early macular degeneration were given zinc supplements. Their macular deterioration slowed, and they maintained their visual sharpness better than those who had only received the placebo. Diabetic retinopathy is associated with diabetes, and it's a major cause of visual impairment and blindness. Retinopathy develops when high blood sugar levels damage the blood vessels in your retina. Omega-3 fatty acids also prevent other eye diseases. A study in middle-aged and older adults with diabetes found that taking at least 500 milligrams of long-chain omega-3s daily may reduce the risk of diabetic retinopathy. You can check out my other video on diabetic retinopathy for more specific information on ways to help to naturally treat this condition. Glaucoma. It's a group of diseases characterized by progressive degeneration of your optic nerve, which transfers visual information from the eyes to the brain. Glaucoma may cause poor eyesight and even blindness. Cannabinoids. Going back to the 70s, studies have shown that cannabinoids can alleviate glaucoma-related symptoms because they lower the intraocular pressure and they have neuroprotective actions. For example, in 1971, a study found that ingestion of cannabis lowered the intraocular pressure by 25 to 30%. You could see my other video on CBD and blood flow in the brain for more information about CBD's health benefits. People with diabetes are twice as likely to develop glaucoma as non-diabetics. You can check out my other video on type 2 diabetes for easy ways to improve your insulin sensitivity and to reduce your blood sugar levels naturally. Observational studies show that people with cataracts tend to have a low antioxidant status. They also indicate that people who take vitamin C supplements are less likely to get cataracts. While the fluid around the eye lens is normally already high in vitamin C, researchers speculate that consuming foods rich in this vitamin gives an extra added boost to the vitamin C level in the fluid in your eyes. One analysis suggests that consuming more than 7 milligrams of vitamin E per day also may reduce your risk of age-related cataracts by 6%. Again, like most illnesses, diabetes has been found to double your risk of cataracts. The superfood Moringa has been shown to protect against cataracts by increasing antioxidant activity. New research by scientists at Brigham and Women's Hospital and Harvard Medical School have found that long-term daily use of multivitamin supplements can work to reduce the risk of men developing cataracts. The research team, led by Dr. William Kristen of Harvard Medical School, published its findings in the Journal of Ophthalmology and said current study results mimic previous research indicating that vitamin supplementation is helpful in boosting your eye health. New research published in Ophthalmology, the Journal of the American Academy of Ophthalmology, concludes that taking antidepressants like SSRIs substantially raises the risk of sight-threatening cataracts. Some final tips. Eat a varied diet, a low-carbohydrate, high-antioxidant, high-anti-inflammatory diet. Quit smoking. Wear sunglasses. Use safety eyewear. And don't stare at a computer screen for too long without taking a break.